Are less healthy now than they were before the start of the COVID pandemic, according to a new report released earlier this week. Our Jason Raven has the story.
According to state health officials, this data shows there is a lot of ground the state needs to make up on this front, and they say schools cannot do this alone. The data reveals a decline in the health in the state's kids. It comes from the yearly fitness gram, where participating schools collect fitness data from students in 2nd, 5th, and 8th grade, along with high schoolers. Or Dr. Russell Pate with the University of South Carolina's Arnold School of Public Health says this report shows the pandemic harmed children's health by depriving them of the physical activity they normally received in the school setting.
The bottom line is kids need physical activity to be healthy. They need physical activity to develop normally. They need physical activity to reduce the risk of negative health outcomes, and they need physical activity to learn well.
The report shows the percentage of children in the healthy weight category decreased from 65% pre-pandemic to 59% post-pandemic, and the percentage of students in the healthy fitness zone for heart and lung function declined from 60% to 51% in that same time period.
Our sense is that with all the changes, particularly the changes associated with the schools during the COVID years, kids' physical activity was reduced, and because of that, their fitness and weight status were negatively affected.
Pate says he is hopeful this data will help families and communities get more active.
Their bodies are resilient and adaptive, and if kids become more physically active at this point, they can recover fully.
Officials say there are also several disparities in the data, like a disproportionate number of Black and Hispanic children scoring lower on all testing than their white peers, and students living in poverty were less likely to achieve the healthy fitness score. In Columbia, Jason Raven, 7 News.
Officials say this fitness gram data is used to support programs and policies in public schools to try and improve the health of children.